So tonight I'm taking up the request of a patient, Sarinda. Thank you for suggesting this earlier in the week, on the subject of abdominal breathing, or how I quite enjoy to call it belly breathing. You know, it goes with the Scottish word for an abdomen. So tonight, belly breathing is something that I've incorporated into my practice because it's an essential way of helping reduce the stress that can be going on in our lives. In particular, if you've got anxiety or you're struggling with, anxious thoughts or, troubled thoughts that, it's kind of making you unsettled within yourself. It's certainly probably making your stress levels go higher and pain levels higher. And abdominal breathing is just a way of returning to the body, returning to the center point of who we are. It's fascinating in the world of chronic pain that one of the strategies that we utilize is we avoid thinking about our body. We kind of get distracted and we kind of get lost in our mind, somewhere out there, somewhere around us, but it's not literally in our bodies. And this technique is literally the opposite. It's to ground you, just like a tree is grounded, it's got big roots into the earth. So too we need to be grounded in our body, and this abdominal breathing or belly breathing technique is very helpful for this, and it's something I use myself, and it's also something my patients get lots of rewards from, and it just helps them in the moment. So what is it? Well, abdominal breathing is essentially using your diaphragm. Now, interestingly enough, let's do a little experiment here. Everybody watching, could you just take a deep breath? Okay, now I'd like you to do that again, and I'd like you to think about where you're inhaling. Is it your upper chest, or you can't quite see my lower hand here out of camera? Let's just move back, see if we can see it. One of the cameras on Instagram, you can see my lower half. My Facebook camera, you can't. But anyway, take a deep breath and see which hand moves first. Is it this one? Like the upper hand, or is it the abdomen? So about 98% of my patients, when I ask them to breathe, it's the upper chest that goes first in the inhalation. And that is a learned response. It happens early in childhood and continues throughout the majority of our life. And I would say probably 98% of us are breathing from our upper lungs. And this is the problem, because if we breathe from here, it means we're shallow breathing, and that's a symptom of a stimulated sympathetic nervous system. That's related to stress, that's related to the pain that you're experiencing, in comparison to abdominal breathing, where your lower hand would be moving, your belly sticks out as your diaphragm descends into the abdominal cavity, and therefore your belly must go out as you inhale. So this is one thing that I encourage my patients to learn. If you've got young children or grandchildren around you, watch them breathing, and they will be your teachers. Alternatively, you can go online and you can Google abdominal breathing and just watch what that is. But if you're finding it, if you're trying to do it and it feels strange, well, that's perfect, because that means it's something different and new for your brain to figure out, and you're probably on the right track. So just a little tip: as you breathe in, you want to stick your belly out. You just want to literally push it out, and as you exhale, you suck it in. You suck in your belly. So let's just breathe in, belly out, and then breathe out, belly in. And the more you suck it in, you've got no alternative but to push it out on the inhale. So breathe in, belly's out, and then inhale. Sorry, exhale. But hopefully you're getting the idea here. So inhale, belly out, exhale, belly in. And just to recap, your diaphragm is lowering into the lower part and expanding the lower half of your lung as you do this. And you literally use probably a third more of your lung capacity if you're focused on your abdomen when you're breathing. So, I'd like you to just think about that this week. I'd like you to sit down, put your hand on your chest, hand on your stomach, and just practice getting your belly moving in and out, and spend about 5 minutes doing it, and try and get used to this concept. Definitely do it every day, because if you're doing it every day, then you're going to get used to it, and be reassured that as you do this, you're teaching your brain to switch off that sympathetic drive and on the parasympathetic drive, or you're switching off that stress response and on that healing relaxation response. And you're literally getting in touch with your inner being with a simple breath exercise. So, if you're able to do this, and say you can just do it at the drop of a hat, you can just belly breathe, then I'd introduce that through the day. I encourage my patients, and as I do these things every week, I'm feeling that you out there are my patients too, and I'm getting this feel that I should be sharing what I'm sharing in my office with what I'm sharing with you. And as we go forward, then you get all the benefits what I do in my day job with this education. So this is what I say to my patients throughout the day: pause for 3 breaths every hour. 3 breaths every hour, and just breathe. And if you've learned to do abdominal breathing, do your abdominal breathing, and that will bring a sense of calm, serenity, hopefully, or more serenity in the moment that you're practicing this. So it's extremely powerful, especially if you're in a sticky moment and you're stressed, maybe something going on at home, and you don't want to say too much, but you're feeling a bit stressed. Just go into your abdomen, go into your breath, and breathe, center yourself into your being, and just do this breathing, and just allow your nervous system to change as you go forward. So I think that's enough talking. I'm going to just close off this video. I'm going to spend a few minutes doing some belly breathing, and I hope you practice this every single day. Another tool that you can use as you move forward in this journey with chronic pain. So thanks so much for listening, and we will see you next week. Bye for now.